Hello all, welcome to Practolytics, your healthcare partner. I am back with another fantastic series on transitional care management. This is a four-part series in which you'll be learning about the basics, coding and billing guidelines, utilization requirements, and documentation and other key components in this transitional care management. Firstly, this is Ellen Green from Coding Operations Practolytics, and I'm a certified coding specialist from AHIMA. With no further delay, let's begin the video. Transitional Care Management. We simply call it as TCM services. This addresses the handoff period between the inpatient and a community setting after a hospitalization or other inpatient facility setting. We can take an example like a skilled nursing facility. The patient may be dealing with a medical crisis, new diagnosis, or changes in medication therapy. Family physicians often manage their patients. TCM helps smooth their transition back home after a discharge from medical facility. Let's see who can actually furnish this TCM service. Healthcare professionals who may furnish and bill TCM services are physician from any specialty, clinical nurse specialist, nurse practitioner, physician assistant, certified nurse midwife, or a non-physicians must be legally authorized and qualified to provide TCM service in the state in which the services are being furnished. We have discussed that this care gets started after a discharge, and this discharge has some limitations. Let's see the eligible discharge settings. Those are inpatient acute care hospital, long-term acute care hospital, skilled nursing facility, or simply a nursing facility, inpatient rehabilitation facility, hospital observation status, or it could be partial hospitalization as well. Every service that is getting rendered to a patient will be having a goal for sure. The goal of TCM is to avoid the patient being readmitted to a hospital. And now, let's understand the key takeaways from this concept. TCM helps streamline your transition from a medical facility back to your home. These services are offered by a healthcare provider in the 30 days following your discharge. Some of the services provided with TCM include an inpatient visit, interactive contact, medication management, scheduling follow-up visits, coordinating with your other healthcare providers, and many more. Usually, Medicare Part B covers TCM services. They are also covered if you have a Medicare Advantage. That's nothing but your Part C of Medicare. And the exact cost of the TCM can depend on what type of Medicare coverage you are having. I hope this video helped you in understanding the basic concept that's been associated with the transitional care management. And we will be back soon with another video on this TCM with the coding guidelines and the reporting instructions that are associated with this transitional care management. Please stay tuned to this channel for much more content. Thank you so much for your time.